The drug shortage in the United States has reached a 23-year high. Managing what's available and what's not takes up a lot of time for pharmacists at local hospital systems. So we spoke with the vice president of UPMC's pharmacy department to find out how the historic shortages are impacting hospitals and families here in Pennsylvania. Staying ahead of drug shortages is a constant battle for UPMC pharmacists.
We definitely feel that every year there's more drug shortages to worry about.
New American Society of Health System Pharmacists data shows 323 medications in short supply across the country, the highest since tracking started in 2001.
It primarily affects us in the drugs that are available as generics and the drugs that are available as IV. So we do spend a considerable amount of time managing and changing and sort of fixing things in our electronic system to help the doctors go to the drugs that we do have and kind of shift them away from the drugs that we don't have.
Vice President of UPMC's Pharmacy Services, Rebecca Taylor, says unfortunately the shortages have affected IV injectable drugs across the board.
Periodically, there will be an issue with an IV chemotherapy drug. We've had issues with sedatives, pain medications, drugs for nausea and vomiting.
Taylor says a lot of the generic drugs are made overseas now, and if something happens at those factories, there aren't many backup plans. UPMC pharmacists say they're trying to make sure you don't see that.
Our goal is to make as minimal impact on the patient and the providers as possible. So at any one time, like 1 to 3 pharmacists are working on drug shortages. I do worry about patients in rural areas a little bit more, because I think that there's less opportunity to source.
Taylor hopes lawmakers will help implement drug price changes and a way to tell hospitals about expected shortages. For now, coming up with a game plan every day is the new normal for them.
We've become honestly pretty good at it. And, again, our number one concern is keeping the patient as safe as we can.